Blackmore. I'm at the University of Stirling, and my PhD is titled Exploring the Health and Wellbeing Effects of Horticulture and Gardens. I'm just going to tell you something about the literature review today, and just right towards the end, an outline of the study that's actually going to take place this year. I'm being supervised by your own Fiona, who's actually just disappeared for the second, Fiona Thackeray, and by Ruth Jepson at the University of Stirling. So, as I said, I'm going to tell you about the summary of the literature. The literature review is in the form of a realist synthesis, and you don't need to take that away with you as such, but it just tells you what works, under what circumstances, and for whom. And you will have picked up, as we've been talking, there are just such a lot of ways that community interventions like gardens and horticulture can be working, and it's reasonable then to assume that they're working for different ways for different people under different circumstances. So this is why we've looked at the literature in this way. And what it looks at is the kind of underlying mechanisms behind how does this health and well-being effect come about. The literature actually is in the form of looking at horticulture as therapy, community gardening, people's gardening in their own homes, gardens as nature, and also a little bit about plants indoors. And I've got one here for you, Charlie, which is that you do actually need to have some house plants, ideally some herbs or something you can eat, because there is some good evidence about plants indoors. There's a range of participants that have been looked at. I've looked at literature from all over the world, and lots of different types of research, lots of different styles of intervention, and so on. And I haven't got time to go into all of that. 122 papers are included, which is quite big for a literature review for a PhD. And given that it has to be written up as what works, under what circumstances, and for whom, it will be quite a long-winded document, but I think it will encompass much of what's been said already, and possibly a little more. My comments about the research are just to say that actually the research is quite patchy. There's no consensus about how to measure what good gardening does, and people have looked at little corners, if you like, in an attempt to understand tiny bits, and some of them have done it. There's one or two randomized controlled trials, but there's an awful lot of anecdotal evidence and moving around into some quantitative, qualitative, and mixed method studies. So what do I mean by the health and well-being effects? Well, we've heard a little bit already what people mean when they mean health and well-being, but what we're really looking at is through measured improvements or increases in certain factors, which then lead to reduced risk factors for chronic conditions, things like cardiovascular, certain cancers, diabetes, through reduced overweight and obesity, that sort of thing. Improved function, I think we talked about rehabilitation is what I mean there really. Improved symptoms in existing conditions, and reduced rates of degeneration in conditions that are existing and will degenerate but actually can be checked. And these are achieved through things like quality of life. And this actually image, I've put this one first because this represents the biggest area, single area of research, which is in dementia care and Alzheimer's and related diseases, particularly secure care units. And there's good evidence that actually gardens are good for older people, but there's also, for symptoms, for example, for agitation and for sleep patterns, but this can only be achieved with good design and management. And I would say that some of the studies have actually focused quite a lot on what the problems with delivering those are. Another big area of definite evidenced research is that gardening improves mood and reduces stress. And I think that actually comes up in lots of different ways. Gardening improves self-esteem, and this represents where, in particular, where groups have been marginalised or stigmatised, and that is actually one of the areas which has been looked at quite well. Again, social relationships been talked about before. The evidence for this, you'd be surprised it's not as well evidenced as you would imagine, because you would think that this would be one of the things that they would ask. But Certainly the UK research is quite good on this, and this is one of the things that I tend to look at in my study. And it's been looked at in different ways, one of which is ideas of social capital. Physical activity of gardening is quite well evidenced in terms of, yes, it does actually compare quite well with walking, running, these sorts of things outdoors. Certainly, physical activity outdoors has been evidenced to be better for you than physical activity indoors. And it's also well known that gardening is actually good for an incredibly wide range of people, that with the smallest amount of movement you can get something from gardening right the way through to some sustained, vigorous physical activity. And in doing that, you can actually measure improvements in the greenery and the outdoor natural spaces in urban environments in particular. And this is evidenced to improve people's mood, but people's stress levels in environments where there's well-designed green outdoor spaces are lower, and also people's behaviour, people's levels of aggression can be lower, and that's been done in a controlled study. The other thing that gardening obviously offers is this work and learning opportunities, and these opportunities work in several different ways. There's obviously the opportunity to actually gain work through having learnt to be a gardener, but that's not always possible. So you can actually change your level of relative social deprivation, if you like, through gardening, but there's also the occupation, the person-centred fit aspect to gardening as an occupation. The other one that can actually be measured, when you start talking about research, what seems like the very obvious starts to look a little more complicated, and things that you can measure, you need there to be a scale, and there is a validated scale of how well communities actually work, community cohesion, and this is one of the things that's been looked at, particularly in the United States. They do have a lot of community gardens in some of the more degenerated urban areas in the States, and so they have actually measured improvements there. Another area that's been looked at, again with community gardens, is creating healthier food environments, and by this means influencing dietary choices. And some of the evidence relates to children's nutrition education programs in schools, where the ones where there was a practical gardening element were more effective than just nutrition education programs per se. Another aspect of gardening is that it gives you an opportunity for daylight exposure, and there's two aspects to this. One is that it can actually improve sleep rhythm patterns, but also there's this opportunity for vitamin D. Now, some of the health benefits that we're looking at in gardening, I've only been able to include papers that actually specifically say gardening. Some of these benefits may only be evidenced in other circumstances. So we know, for example, that vitamin D, improved levels of vitamin D can actually improve several health things, particularly mental health, but this may not have been looked at with gardening as a focus. So there's some extrapolation to be done here. And finally, but not lastly, or not leastly rather, is the idea of gardening and meaning to life. We talked about hope. There's a sort of spiritual element, and some research that was done with women, particularly women with in particularly stressful situations. And this seems to be actually a recurring theme, is that the more stressed and difficult people's circumstances are, gardening seems to be a great way to achieve results relatively quickly, and also to engage people who it may be their first possibility of engagement. And actually, one of the things that I thought was quite interesting, and it was almost a sort of passing remark in one of the papers about older people, is that one of the last things to go is people's recognition of the natural world. So when people can barely recognise where the door is, once they get outside, they seem to relax because they actually see a tree, and those things are quite deeply ingrained in our memories. So what is it about nature and gardens that's particular? Because some of those things that we've talked about could possibly be offered by other programmes that don't involve gardening. And I just want to talk a little bit about the background theories. the sort of overriding one of which is biophilia, which some of you will have heard of. And the idea of biophilia is that we, as humans, have evolved with common ancestry in the African savanna, and these two images, believe it or not, are of the African savanna. And the idea is that we are therefore naturally programmed to respond positively to that kind of environment. And what we get from that is a sort of people-plant relationship that has its centre around affordances. What can that landscape afford us? And what are represented here by those pictures are the affordance of food and obviously water, the affordance of medicine through the plants, the affordance of safety and security, and the affordance of shelter. And these things are, again, this is like the last thing to go, is recognising those things about the outside space. And the sort of sub-theories that go along with biophilia, or come out of it, if you like, are, the first one's called aesthetic affective theory, and this is the idea, and those of you will have heard of the Ulrich study about people recovering more quickly in hospital rooms with a view of trees. This is the same basis as that, and it's the sort of very basic fight or flight part of the brain, which tends to stress under these sort of artificial urban concrete environments, and that softening that with natural green spaces can actually actively affect people's stress levels, but also, as I said, their aggressive behaviours. The next and slightly more cognitive front brain thinking part of the brain is affected through attention restoration theory, and the theory is that, then this is the Kaplan's theory, the idea here is that people become very stressed by the sort of demands of modern life, by reading and studying and those sort of things, and, well, even just going about your business, but in an unnatural environment. And through gardening and nature, we can regain some of that cognitive function. And thirdly, again, with nature at its heart, is the idea that we develop as children in an environment, and if as children we're exposed to a certain type of natural world, and in this case we're looking at these children with a close relationship with trees, then we're more likely to seek that out as adults. And whether that actually takes us as far as living in a tree house, not quite sure, but it's a nice idea. So when I'm talking about the actual research, this here, the butterfly, actually represents what we're actually studying of the phenomenon of gardening. And the butterfly here represents the idea of things we can count about gardening. So perhaps the spots on the butterfly, something about the colour, how long does it spend in the air, not on a flower, for example. And that would be the quantitative. The background is filled in by qualitative data, so asking people, what do you think about, what's your experience of gardening? What context is the gardening done in? What's the community garden project actually like? So that's the overall picture. And through mixed methods, which is what our study's going to be, we're trying to get some sort of big picture like this. What the research looks like actually at the moment is more like this, and this is being quite generous to the actual size and focus of the research, to be honest. I think the white spaces is where the gaps are, and I think the white spaces might well really be bigger than this, but it's just to give you a kind of idea that it's a patchwork. People have looked at lots of different aspects. They may have overlapped a little, but not as much as you'd think. And we'll be trying to look to fill in a piece of white space with the research. So what am I actually going to do in this PhD? I'm going to be a 4-site study, ideally places in with an index of multiple deprivation in Scotland. I'll be taking a baseline measures, ideally when people are just starting to garden, again at 6 weeks, again at 12 weeks, followed by talking to people in focus groups, discussion groups. The first set of data will be in the nature of this quantitative data, so questionnaires, some physical measurements. The second bit of data will be through the discussion groups, followed by some analysis, followed by writing up.